आयुर्वेदा एट 2047, इसी की श्रृंखला में ये आयुर्वेद के लोगों को स्किल डेवलप करने के लिए और स्ट्रेंथन करने के लिए, नॉलेज गेन करने के लिए, कॉन्फिडेंस डेवलप करने के लिए इस प्रकार की संभाषाएं विश्व आयुर्वेद परिषद आयोजित करता रहा है। और आज प्रशांत गुप्ता जी के उद्बोधन से निश्चित ही हम लोग लाभान्वित होंगे। अब मैं डॉक्टर पंकज से अनुरोध करूंगा कि कार्यक्रम की शुरुआत के लिए धन्वंतरी वंदना की जो है करें।
डॉक्टर सुनीता,
डॉक्टर सुनीति एंड डॉक्टर पूजा सिंह। डॉक्टर पूजा एंड डॉक्टर सुनीति।
धन्वंतरी स्तवन कहना है बॉस, मैं क्या देता हूँ?
डॉक्टर पायल जी, हेलो डॉक्टर पायल जी।
मैडम म्यूट अनम्यूट कर लीजिए।
हाँ जी सर। सर इंट्रोडक्शन स्टार्ट करूं मैं क्या?
हाँ कर दीजिए मैम, कर दीजिए।
नहीं सर, पहले धन्वंतरी स्तवन 1 मिनट कर ही लेते हैं, जब करना था तो कोई करने वाला था ना, नहीं तो मैं करा रहा हूँ। ओंकार की स्थिति में आ जाइए, 3 बार ओंकार करके धन्वंतरी स्तवन सिर्फ सुनेंगे। नमामि धन्वन्तरिनादिदेवं सुरासुरैवन्दितपादपद्मम् लोके जरारुग्भयमृत्युनाशम् दातारमीशं विविधाशदीनां न त्वं कामये राज्यं न स्वर्गं न पुनर्भवम् कामये दुःखतप्तानां प्राणिनाम् अर्पिनाशि।
धन्यवाद सर। इसी क्रम को आगे बढ़ाते हुए मैं डॉक्टर पायल ठाकुर जी को आमंत्रित करता हूँ, हमारे जो स्पीकर हैं उनका परिचय कराएं।
Thank you, Dr. Pankaj. Good evening, everyone. I bid a very warm welcome to all who took out their valuable time and joined us today to be a part of this event, Kaumarabhrtiya, organized by Vishwa Ayurveda Parishad. It's a great pleasure for me to introduce my guide and our guest speaker, Dr. Prashant Gupta, sir, who is going to talk about Swarnaprashan and current research. Before calling upon Dr. Prashant sir, let's have a brief introduction about him. Sir is Rashtriya Sachiv of Arogya Bharati. Presently, he is working as Associate Professor in PG Department of Kaumarabhrtiya in All India Institute of Ayurveda, Delhi. Sir completed his graduation in 2006 and post-graduation in 2009 from Banaras Hindu University. Sir has teaching experience of 16 years both in UG and PG and has completed many research projects. Sir published 3 books and is member of editorial board of various national journals. Sir presented more than 5 papers in conference and published more than 35 research papers in various journals. He has organized medical camps in tribal areas of Uttarakhand, Manipur, Mizoram, Meghalaya, Assam, Arunachal Pradesh, Chhattisgarh, Andaman and Nicobar. Lifetime member of Red Cross Society and Vishwa Ayurved Parishad, Delhi. I am sure his presentation will be informative, engaging, and thought provoking. Now, I would request Prashant sir, please enlighten us with his wisdom and knowledge.
Thank you very much, Dr. Payal madam. At the outset, I would like to say namaste to my all seniors, Professor Mahesh Narayan Bose sir, Dr. D.K. Rai sir, Dr. Ramesh Gupta sir, and other who I cannot view. But so, am I audible clearly?
Yes, sir.
Yes.
Okay. My slides are visible.
Yes, sir.
Okay. So, should I go now in a mode? Just a minute. Is it visible now?
Yeah, sir. Visible.
Is this in presentation mode now? So today I'm going to discuss maybe Dr. Pankaj ji. Now I request kindly mute the participants except
Yes.
our organizers. Kindly mute all others.
Okay.
Okay. So today we'll discuss the Swarnaprashan and their current research. So I'll briefly speak about the historical prospects of the Swarnaprashan, and then we would directly come on to the current research. I would like to thank many people who actually did work, and I now took all things into my PPT. So at the last, I would say thanks to them by name. So hopefully, Dr. Pankaj, most of them are either Kaumarabhrtiya fellows or practitioners.
Yes, sir.
Okay. So I would love to take questions after the presentation.
Okay.
So I am Prashant, served in many places, currently at All India Institute of Ayurveda. Starting with Lehan, what is Lehan? We all know that anything which is leakable is called Lehan. Another term is also very usefully or utilized in parallel term of Lehan. It is called Prash or Prashan. So that is also a similar word, but Prash has slightly difference. But as of now, we'll synonymously take that word. It's in semi-solid combination, so we know except few tablets which are available in market, all Lehanas or all Swarnaprashans are Lehan. 1 or 2 tablets are available in market which is in solid form, and that has to be dissolved in water or in a desired liquid before giving it to the kid. Kashyap has given a separate chapter on Lehan. Basic concept of Lehan was to supplement the nutrition, enhance the immunity, develop the physical and mental strength. Swarnaprashan is one among the Lehan, which has Swarnabhasma, honey, ghee, and some herbal drugs later in 7th century and later. And multiple authors has given their own type of Swarnaprashan, although they have not written the word Swarnaprashan, but that combination supposed to be an Swarnaprashan. So starting with evolution, 6th century, Kashyap said that Swarna, Grit and honey can be given. An indication we all know that shloka also. So Medha, Agnibal Vardhanam and Ayushyam, Mangalam, Punyam, Vrishyaram. Multiple words they have given. And then in second BC, Shishrut says 4 type of combinations. Among them, we did one research also. We'll discuss it in later slides. He has given 4 combinations, but the indication again is for Medha Balvardhan. Coming on to the next 6th century AD, Ashtanga Sangraha also says that Hema Raja Vacha has a combination with Ghat and Madhu. Then they also said that it is a Rakshogna. Now a word Rakshogna has been added. Before than that, Ayush, Grahopaham and Medha Jananam was there. But Rakshogna was first time at 6th AD. In fact, Agnivardhan was also not the same term which actually been used in the previous Samhitas. 7th century, Ashtanga Hridaya said that Swarna, Grata, Hani, Shvetavacha, Matsyakshi. So Matsyakshi was the word. Actually, Shushut also taken that word. And Arka Pushpa. Surprisingly, right now, no Swarnaprashan is having Arka Pushpi or Kaidarre. Shweta Durva, I don't know if it is given in Dakshin Bharat in Swarnaprashan or not, but in North India, Shweta Durva is also not.
प्रशांत सर,
Yes.
सर ये स्लाइड मूव करना है या स्लाइड मूव?
अच्छा, स्लाइड मूव नहीं हो रही है क्या?
नो सर.
आई एम सॉरी. ओके, सो अभी हो रही है क्या?
हाँ सर, होगा. यस सर.
अच्छा, मतलब मुझे लग रहा है शायद फिर ना मैं जैसे ही से उस मोड में कर रहा हूँ, तो देखिए एक बार फिर से मैं प्रेजेंटेशन मोड में कर रहा हूँ, आप मुझे बताइए.
जी.
चेंज हुई क्या?
नो सर.
ओके, देन आई हैव टू टेक इट इन दैट. तब नॉन शेयर इसी मोड में रखता हूं मैं. ठीक है.
यस यस सर.
ओके, सो इवोल्यूशन नाउ it is visible on the second slide that 6 BC Kashyap said Swarna, Ghat and Hani. They have given an indication. Second BC Shishrut also says 4 types of preparations where he took the name Arkapushpi, Kaidarre, Shvetadurva, Matsyakshi. As of now, whatever Swarnaprashan we are researching, it do not have such type of herbs. The indication was same. Now coming on to the third slide, where 6th AD, Ashtanga again says that Hema Raja Vacha. So this again, this combination is used in South, again for Medha and Rakshogna. Rakshogna was the new word here. In 7th century, we all see all those words or herbs which actually been propounded by Shushruta and taken by Hridaya, Ashtanga Hridaya. 13th AD, Sharangdar again came back to the Kashyap combination, Swarna Bhasma, Ghat and Hani. Surprisingly, not surprisingly, at 13th AD, Bhasma was available. 6th BC, Bhasma was not available. So the word was Swarna, here it was Swarna Bhasma. And at 13th, it is also said that you can give it at birth also. 13th, 14th again, Rasaratna Samuchaya, Pipli and Honey. Pipli for the first time it has been added in Swarnaprashan. 16th, Bhaprakash. 16th, Yogaratnakar. 18th, Bhaishajya Ratnavali. And surprisingly, for the first time, Brahmi word or Brahmi herb was added in Swarnaprashan in 18th century. General information about Swarnaprashan, we as a researcher and as this topic is dedicated to research, recent research of Swarnaprashan, we had a very big issue of calculating the dose. That how that Swarnaprashan dose has to be calculated. Initially, we used to calculate it by just by the Swarna Bhasma dose. The Swarna Bhasma dose and its putting into the young formula or any other formula applicable to the kid, and then dose of the Swarna Bhasma has to be calculated, and then it is been given with honey and drug. But thanks to our colleagues from Jodhpur, they have given a protocol on Swarnaprashan, and they have defined the dose. As of now, it is standard dose because this is the first protocol published by government or at least government institution. So now I'm coming on to the current publications. So we all know that when you are finding something, there should be some constant word, and Ayurveda, especially Swarnaprashan, has a very challenging thing that somewhere it is written Swarnabindu Prashan, somewhere it is Swarnamitra, Swarnamrit Prashan. Swarnamrit Prashan, somewhere it is SUWARNA. So as WCD 11 is saying that there should be a single term for single disease, we are also planning that. We are also planning, and in fact, we will request the competent authority to keep only one name so that everyone should know that this is the standard name and how to search them. Okay, so coming back to my slides, Swarnabindu Prashana. Again, gold is in Bhasma form. Some other herbs, no other herb. Dose was 4 mg. Indication, healthy children. नक्षत्र पुष्य नक्षत्र में दिया, 6 महीने तक दिया, एंड ओके IQ इंप्रूव हुआ, वेट गेन वेलोसिटी आई, हाइट आई, मूड स्विंग्स कम हुए. ओके, द सेकंड वन वाज स्वर्ण अमृत प्राशन. अगेन द गोल्ड फॉर्म वाज भस्मा. हियर यू कैन फाइंड सम ऑफ द herbs also. You can see Vacha, Jatamansi, Ashwagandha, and dose has reduced to 2 mg gold per dose. And indication was not healthy children. Here you can find cough and common cold. 30 days regime, empty stomach, and it was done in a very reputed institution and a very recognized Kaumarabhrtiya madam. And they said that yes, there is a reduction in complaints of cough and tonsillitis, sleep disturbances, dyspnea, and pharyngitis. Coming on to the next available paper, they took the name Swarnaprashan. Again, the gold form was Bhasma. Other herb, no other herb. 1 mg gold Bhasma up to 5 years. Above 5, this is 2 mg. Again, the indication was not healthy child, respiratory and GI disturbances. 30 days, empty stomach, same protocol, and there is an improvement. The next paper says that Vacha and Kushta was added, 1 mg dose, healthy children was taken, and again that 27-day regime or that Pushya Nakshatra is this. Then the next paper is Swarnaprashan, gold form is Bhasma. The dose is further reduced, 0.7 mg Swarna Bhasma. And thanks to that paper, they have in current literature or in modern literature, this is the first paper where I found that the medicine was given to newborn and up to 3 days. Once a day, morning for 6 weeks. So 0 to 3 days, they started on 0 to 3 days and then they have given it to 6 weeks. So they calculated the morbidity, and this is that the skin problems, respiratory illness, and common other illness were reduced. This paper was published in 16. Again, the name is Swarnamrit Prashan, gold form is Bhasma. Some medications here, first this Jatamansi has been added, Pipli has been added, Yasti Madhu has been added in that Swarnamrit Prashan. Or 2 mg gold is okay, healthy child and everything is almost the same pattern, that improvement in weight gain and height, head, chest, circumference, mid-arm. So nearly looking towards nutrition. Again, Swarnaprashan is the word, Bhasma, everything is same, recurrent respiratory illness and GI illnesses, and there is an improvement. The protocol was Pushya Nakshatra protocol. The next is again Bhasma, 4 drops, no dose was given. So preterm less than 37, this is the first study, thanks to Professor Renu Rathi madam. She published that paper that the medication is safe in preterm. Otherwise, if you are going with such protocols to our IC or any IC, they would ask, no, just check first that safety. So if we are putting that paper on table, and this would be very helpful for every researcher, that we can give it in preterm, less than 37 weeks and up to 0 to 3 years. And daily regime, daily on the day of Pushya Nakshatra for 6 months was the regime. And maybe they found a very good weight gain velocity. The last searched paper is the only paper where gold form was not Bhasma. It was pure gold or Shalaka, not the Patro. It was Shalaka. So pure gold, 3 circles was the dose, means this Gharshan, 3 circles possibly. And weight by volume, it was 0.07. Indication is children up to 5 years. And again, Pushya Nakshatra was the pattern, and GI tract and respiratory illnesses was seen. So these all are some papers which I found, and some other papers which I'll later discuss in other slides. They more or less are the clinical papers. Now coming on to the next slide, we surveyed, although this is a 2021 survey, when we found that there are multiple options available in the market with the name of Swarnaprashan and some other names, and their cost is starting with 100 and going up to 642 rupees per ml, or and the average is nearly I think 213 rupees. So such a disparity, price calculated as per 5 ml of Swarnaprashan, and the expression of Swarna Bhasma was also somewhere it is not written, and if it is written, then it is also not very clear. Let's say a Swarnaprashan which is at a cost of 180 rupees per 5 ml, the Swarna Bhasma was only 0.2%. And Swarnaprashan with a rate of 642 per 5 ml, Swarna Bhasma was 0.1%. Even less than 180 rupees sample. Swarnaprashan with 465 rupees per 5 ml, Swarna Bhasma was 0.2. And another sample having a 416 rupees per 5 ml, Swarna Bhasma was 15 mg per 5 ml. So such a disparity, in fact, a association or a group like us should say something about it. And if the cost of the gold is nearly 90,000, how can we give the Swarnaprashan in such a low cost? I'm not saying that it is not available. If someone is doing it voluntarily, it is okay. Otherwise, the sustainable economic model is not will not allow us to sell at such prices. Now coming on to the research. This research we have not yet published, but we compared the antioxidant property of 4 type of Swarnaprashan advocated by this Shushruta. Sample 1 was Swarna Bhasma, Ghrut and honey. Sample B was Swarna Bhasma, Ghrut, honey and Acurus. Sample C was having some herbs, and sample D where Bhasma was not used, gold foil plus Ghrut plus honey was used. You would be surprised, we usually compare that antioxidant property with tannic acid concentration, and results are surprising that the maximum antioxidant property is in sample A, where only Swarnabhasma, Ghrata and honey was given. No herb, maybe it is Acorus calamus, maybe it is Matsyakshi, maybe it is Arkapushpi, maybe it is Brahmi. We don't know that how that antioxidant property has reduced, but the maximum antioxidant property was seen in sample A, which is visible in slides also. So I would not advocate, I'm just showing the result that just giving Swarnabhasma, Ghrata and honey as in combination would give a better antioxidant property. We did the FTIR of all these 4 samples. Surprisingly, you can find a pattern at 2924 and 1650 to 1700. This is a particularly 4 type of Swarnaprashan having different type of peaks, possibly maybe due to the pollens or the herbs mixed in all 4 types of Swarnaprashans. So why I am showing it? Because once you want to standardize the Swarnaprashan, you must have to have an FTIR, or you must have to have an fingerprint of that solution, so that when the system has to compare the existing or the available solutions in the market, there should be a standard platform FTIR. So we produce this 4. Multiple studies has now produced FTIR also. So these all things should be somewhere incorporated in maybe in pharmacopoeia, or maybe some recommendations from institutions, those who have given a protocol earlier also. Now coming on to the tandem electron microscopy, tandem mass electron microscopy. Here you can find the structures are different. Here you can cuboid. Here you can some sort of this arrow is visible in screen. Dr. Pankaj, arrow.
Yes, visible.
Yes, sir.
Okay.
Yes.
Okay. So you can see there is a pure amalgamation, although the size of the particle is in nanos and micros, but the herbs changes their surface morphology, and I will discuss it in later slides also. So this is it's an aggregate of nanoparticle, and all 4 shows some changes on surface. Rest the size was same. So electron microscopy had not helped a lot, but yes, we had to do it, and we were the first who did this. Now coming on to another very interesting question. Usually people ask us, your Swarnaprashan has a bhasma, a metal, and something and something and something. So we prepared all these 4 samples and sent for ICP-AEMS, inductively coupled plasma atomic emission spectroscopy and spectrometry, whatever. And we checked the metals present in our samples. You'd be surprising that iron was available in all 4, although we said it is Swarnabhasma, but iron is there. Copper in sample B, C, and D, copper was also there. You can see when I took a foil, the copper was more. Sample D is a foil सोने का वर्क लिया था हमने, and that was highest. That copper was highest in that. PB was in part per million to an extent of 3, 3, 0, and 4. All are permissible. The PB and the arsenic was nowhere visible in part per million. Silicon was there in C and D. So again, when we are not taking the bhasma form of gold, the silicon and copper was more, and gold was also more. Sample B, sample C. Sample C was the sample where the gold was least. So this is just an outlook that how we should think about researching in Swarnaprashan. So once you are taking the sample into the market, everyone can ask you that does your sample has this arsenic or lead or something. Now coming on to the next very interesting finding. This shlok is taken from Shushruta Samhita, and there is a word which is called Matsyaksha. Second line you find Matsyaksha, and in the Hindi it is written Brahmi, while it is not Brahmi. We took two samples. One is Matsyakshi and the Bacopa. So the Matsyakshi is Seychelles. We took that both the samples and run their HPTLC. We found that they are nowhere very near to each other. There are different bands. RD values are different. You can find that A Seychelles has a different bands. Although Bacopa and A Seychelles has some sort of same pattern, but rest Seychelles is different. So this was first time we produced that no Matsyakshi and Brahmi are different. So if this combination has to be prepared, kindly take Matsyakshi, not the Brahmi. Another research which our group did is an interesting pattern of gold. In fact, this Swarnaprashan, where we loaded something and released. To your surprise, that when some medicines are being loaded on Bhasma, there is a loading capacity of Bhasma, and there is a releasing capacity of Bhasma also. And this is very interesting to tell you that if you keep Swarnaprashan as a drug delivery vehicle for your known drugs, it could help to reduce or to cure that disease which has to be cleared by that herb which is loaded on Swarnaprashan. So if you want to give some medicine, you can give it through Swarnaprashan. That's what the aim of this slide is. Okay, now another paper published from VHU, thanks to Professor B.M. Singh sir. He did a very good research in last 3, 4, 5 years especially on Swarnaprashan. You can find that in the second form, you can find the embedded matrix over the Bhasma or the metal particle, which is very, very important, may have a very long-term impact on the research on Swarnaprashan. This is the first paper where we actually said that there is a fluorescing particles in the Swarnaprashan or in the Prashan. And this is XRD, where you can find in sample the AU is very high. Coming on to the next, the same paper, they did a very good interesting research that if they add something or even not adding something, they just checked if we are giving it orally. Let's say we are giving a Swarnaprashan to an newborn orally, then we have to take care of two things. First, that oral formulation must not have a bacteria or a pathogenic bacteria. And second thing, if this Swarnaprashan is going to change your biome in the gut, it should not hamper or disturb or destroy the GRAS, generally recognized as safe bacteria. So we did a very sir did a very good research where they searched the pathogenic bacteria, that Staphylococcus aureus, E. coli, Mirabilis, pneumoniae, aeruginosus, and the typhi. And you would surprise that Swarnaprashan showed a very good inhibition, as similar as Swarnabhasma. So, aeruginosa and typhi, Swarnaprashan is having a very good result. So why I'm showing this slide, that when you are thinking Swarnaprashan to be prescribed in a newborn or in a pediatric age, even such infections can be controlled by using Swarnaprashan. A very interesting picture from a different paper, you would find that Pseudomonas, you can find that this is an untreated Pseudomonas which has a different structure, a very particular structure of Pseudomonas. But when it is been treated with Swarnaprashan, you would find that there is a dying cell lysis. Cell means surface lysising, means this cell क्या बोलेंगे इसको, wall damage was seen. So when we treat this Pseudomonas colony with Swarnaprashan, there is a clear-cut cell wall damaging, or a depression, or a punch-like structure is usually been seen when the bacteria is dying. So friends, next time when you are treating a Pseudomonas anywhere, be in your clinic or in hospital or in intensive care, always think of whether can I start Swarnaprashan to the baby as soon as it is out of danger. I'm not recommending it, but I'm saying that please think that way. It is real integration. Otherwise, it's good to give in healthy child. The paper says that there is an oxidative stress. This is again a clinical paper where the SODs, superoxide dismutases, and GSH was seen, and there is a clear-cut improvement, and it shows that Swarnaprashan is an antioxidative or a oxidative stress reliever. Now coming back to our own research, we have time. We have time, na sir?
Yes, sir. Time है, sir.
Okay. This is a study which maybe published in next 2-3 months, where we just saw that can this Swarnaprashan be given in a hypoxic kid. We usually saw kids of cerebral palsy, and those centers having a good maternity care and an ICU or a newborn care. They also saw some HI sequelae in their NICU or in wards. So we took it as a challenge that whether this Swarnaprashan can be given in HI sequelae or in simply in a hypoxic insult conditions. We did an experiment on cell line, a neuronal cell line, and we treated that cell line with some different protocols, and surprisingly we saw a very encouraging result. Let me tell you that if we have to induce a hypoxia in a cell line, we have to treat it with cobalt chloride. Then only the hypoxia could be treated. So you can see there is a protein ladder. This is a control ladder. This is a cobalt chloride ladder. this is only Swarnaprashan, and the fifth one is combination of cobalt chloride and Swarnaprashan. अब मैं इसमें आपको बात बताता हूं कि हमने इसमें HIF-alpha-1 एक फैक्टर होता है। जब शरीर में ब्रेन में जब हाइपोक्सिया होता है तो हाइपोक्सिक इस्कीमिक फैक्टर ब्रेन रिलीज करता है, जो कि प्रिवेंटिव होता है, हाइपोक्सिया से जो इंजरी होने वाली होती है उसको बचाने में मदद करता है, और ये नेचुरल फिनोमिना है। और 2010 के बाद ही इसको नोबेल प्राइज मिला जिसने ये इन्वेंट किया, हाइपोक्सिक इंसल्ट फैक्टर, हाइपोक्सिक इस्कीमिक फैक्टर। हमने वो ये प्रोटीन आइसोलेट करने के लिए मतलब वेस्टर्न ब्लॉट किया, और पहले हमने सेल लाइन को ट्रीट किया, ये 4 लैडर्स जिसमें जिसमें सिर्फ और सिर्फ हमने कोबाल्ट क्लोराइड लिया है, और आप देख सकते हैं कि इसमें HIF-alpha का एक्सप्रेशन आ रहा है, मतलब कि सेल अपने आप को बचाने के लिए HIF-alpha बना रही है। फोर्थ लेन में आप देख रहे हो जिसमें हमने हाइपोक्सिया इंड्यूस नहीं किया, हमने खाली सेल को स्वर्णप्राशन दिया, और खाली सेल जिसको हाइपोक्सिया नहीं था लेकिन स्वर्णप्राशन दिया, आप देखो वहां एक मेन बैंड आ रहा है HIF-alpha-1 का, लेकिन आसपास जो आ रहे हैं वो आइसोमर बैंड्स आ रहे हैं। आइसोमर बैंड्स भी होते हैं इसके, और ये आइसोमर बैंड्स रूटीन में आ रहे हैं। इसका मतलब कहीं जब हम ये कहते हैं कि हमारे को डी स्ट्रेस करता है स्वर्णप्राशन, इवन हमारी सेल को फिजिकल स्ट्रेसिंग नहीं है तब भी वो डी स्ट्रेस करता है, तो ये बात सत्य दिखाई देती है यहाँ पे। और 5वें में तो आप देख सकते हैं कि जब हमने कोबाल्ट क्लोराइड के साथ इंड्यूस किया था खाली, तो ये बैंड वीक था, लेकिन जब हमने कोबाल्ट क्लोराइड और स्वर्णप्राशन के साथ किया तो आप देखो HIF-alpha कितना अच्छा एक्सप्रेस हुआ है। इसका मतलब कि यदि किसी को एक्टिव फॉर्म में हाइपोक्सिया इंड्यूस होता है और आप स्वर्णप्राशन देते हो तो उसमें भी फायदा होगा, और जिसमें आपने हाइपोक्सिया इंड्यूस नहीं किया है उसमें भी फायदा होगा। और आपको मैं बताता हूं, ये फोर्थ लेन में जिसमें खाली स्वर्णप्राशन दिया था हमने, उसमें ये 3 बैंड आ जाने की वजह से हमको ये रिसर्च और आगे करनी पड़ी, और पॉसिबली इसी वजह से हमारा ये पब्लिकेशन रुका है। हम इसमें एक और नई टेक्निक लगा के कुछ एडवांस करके शायद अगले 3 महीने में 4 महीने में ये पब्लिकेशन लेके आ पाएंगे। लेकिन एक बात मैं जो आपको बताना चाहता हूं बीइंग एन क्लिनिशियन, कि अगर हाइपोक्सिया में भी कल को आप देते हैं स्वर्णप्राशन तो ये गलत नहीं है। और ये जो स्वर्णप्राशन हम दे रहे हैं ये सिर्फ स्वर्णभस्म, हनी और घृत है, इसमें कोई न्यूट्रोपिक एक्टिविटी वाली हर्ब नहीं है। This is also very beautiful research. That's why I thought I should share it with you. कुछ लेक्यूनीज हैं जो मुझे लगता है कि हमको एज एन सोसाइटी और एज एन पीयर ग्रुप, क्योंकि विषय परिषद के पास अपना कौमारभृत्य का भी एक परिषद है, तो दे शुड थिंक ऑन इट, कि स्वर्णप्राशन के डोज कैलकुलेशन के लिए कुछ थोड़ा सा और करना चाहिए। SOP बनानी चाहिए जिसे देखो अपने हिसाब से बना रहा है, कोई घृत का रेशियो बराबर कर रहा है, कोई कम कर रहा है, कोई हनी डाल रहा है, कोई हर्ब डाल रहा है, कोई हर्ब में कोई एक्सट्रैक्ट डाल रहा है, तो कोई सीधा पाउडर डाल रहा है, सेल्फ लाइफ डिक्लेयर नहीं है, डोजिंग पैटर्न डिक्लेयर नहीं है, ड्यूरेशन कोई पुष्य नक्षत्र में कर रहा है, कोई प्रतिदिन कर रहा है। तो ये सब हमारा ही काम है, हमें ही करना है। फिजियोकेमिकल कैरेक्टराइजेशन ऑफ, अब 2-3 पब्लिकेशन आ गए स्वर्णप्राशन के फिजिकोकेमिकल पे, लेकिन अभी भी प्लेटफॉर्म या जिसे बोलेंगे हम स्टैंडर्ड फिजिकोकेमिकल कैरेक्टराइजेशन नहीं है। डायनेमिक्स काइनेटिक्स तो अभी थोड़ी दूर की बात है। ADM में भी नहीं पता है हमको कि कितना एब्जॉर्प्शन होता है। एब्जॉर्प्शन शायद अगले 4-6 महीने में एक रिसर्च मेरे जान पहचान में मुझे शायद पता है कि वो काकोटू सेल लाइन पे कर रहे हैं, तो हो सकता है हमको थोड़े दिन में पता चल जाए कि एब्जॉर्ब कितना होता है जब आप मुंह से स्वर्णप्राशन देते हैं, तो गोल्ड कितना एब्जॉर्ब होता है, ये बात पता चल सकती है। इंटर इंडिविजुअल वेरिएशन है, कोई कैसे कर रहा है, कोई कैसे कर रहा है, और इंटर सेंटर वेरिएशन है, दक्षिण में, उत्तर में, पश्चिम में, पूर्व में अलग अलग प्रैक्टिस चल रही है। कुछ लोग हेल्थ प्रमोशन के लिए कर रहे हैं, कुछ लोग डिजीज के लिए कर रहे हैं, कि क्या विच आउटवेट्स अदर्स इज ए क्वेश्चनेबल थिंग। AFI क्या कहती है इस पे, कुछ भी नहीं कह रही है। वेरिएबल SP प्रैक्टिसेस डिफरेंट रीजन्स में, डिफरेंट कंडीशंस में अभी थेरेपेटिकली चेक ही नहीं हुई है। स्टैंडर्ड असेसमेंट क्राइटेरिया नहीं है, वेट गेन वेलोसिटी लेते हैं हम लोग, हाइट मॉर्बिडिटी ले लेते हैं, कितनी बार बीमार हुआ, ये स्टैंडर्ड असेसमेंट टूल्स हैं अभी. रिसर्च ऑलमोस्ट पबमेड, स्कोपस, गूगल स्कॉलर, रिसर्चगेट, ओनली लिमिटेड से 7 है आज की डेट में. 7 पब्लिकेशंस हैं पबमेड सेंट्रल पे और 1 या 2 हैं पबमेड प्रॉपर पे. सेफ्टी प्रोफाइल, although it is safe but still we should publish it. फ्यूचर प्रोस्पेक्ट्स क्या हो सकते हैं? ये स्वर्ण पे अभी तक कोई पब्लिक हेल्थ इनिशिएटिव नहीं लिया गया है. भारत सरकार की साइट पे दिखा रहा है कि एज ऑफ नाउ स्वर्ण पे सीधा भारत सरकार से किसी ने पब्लिक हेल्थ इनिशिएटिव नहीं लिया है, लेकिन बहुत सारे इंस्टीट्यूशंस ने पब्लिक हेल्थ इनिशिएटिव की तरह स्वर्ण को प्रयोग किया है. अमंग देम वन इज yes a very respectable institution of south, Udupi. I think they are doing it since very long, and recently All India Institute of Ayurveda has also taken that initiative of distributing the Swarnaprashan and collecting some data in very simple Google form. No study as of now been done with immunization and Swarnaprashan. There is a scope of doing some immunizations. If we do that Swarnaprashan and immunization alone would be very interesting to see. Disease specific interventions. We propound that this works in this and that Swarnaprashan works in respiratory illnesses, GI illnesses, fever, immunity, but studies are very less. So we must be very precise. Let's say rheumatic disorders, let's say autoimmune disorders, let's say progressive neurological disorders, and adjuvant capacity. Whether the Swarnaprashan can be used as a drug delivery or an add-on with drug delivery. Some research potential areas as per the shlok that yes, Varne, so desquamation pigmentation studies, melanogenesis pathways, melanin transfer mechanisms. These are the areas where we can think of doing some research. And for immunity, TH1, TH2 balancing, TLR signaling pathways, cytokine studies. Cytokine studies, immunomodulation studies are visible. Although I'm not able to see that paper, but once I intersected that paper, yes, one good publication is in domain with this immunomodulation and Swarnaprashan. Chakshusha, whether our Swarnaprashan can be used in ROP or retinal repairs or ROS or simply on vision correction. Medhya, yes. NMDA receptor pathways, BDNF pathways, acetylcholine esterase activities, and some other pathways are now being seen as a nootropic pathways. So these are some areas. I know that some of the listeners are from very reputed institutions. They can take this slide as an potential research clue for their future research. I think this is all from my side. Queries and suggestions are invited. I acknowledge Vishwad Parishad and team, Dr. Ramesh Boss. I would like to thank few names whose publications I've shown in the slide. Professor B.M. Singh Saab, Dr. Sahana, Dr. Verma, my own scholar, and the experts from Dakshin, Professor Rao Madam, Dr. Renu Rathi Madam. Yes, thanks to Jodhpur team, Professor Harish ji, Professor Abhimanyu sir, and my colleagues from All India Institute of Ayurveda, Professor Rajgopala sir and Dr. Arun Kumar ji Mahapatra, Professor Ved Prakash ji, and many more persons. Professor Gupta sir is also here, and that Jodhpur team mein Dr. Rai sir is here. Thank you one and all. If some name is missing from my mind, I apologize for it. Thank you.
धन्यवाद सर. ये स्वरप्राशन पे आज जो ये सेमिनार हुआ संभाषा, वो काफी
इट
अच्छा
वाज
रहा।
बोरिंग यार, आप रिसर्च में ना लोग बोर होते हैं तो मुझे पता नहीं।
जी सर। नहीं सर, तभी आपका जो करंट रिसर्च के बारे में आपने स्वरप्राशन के बारे में बताया वो काफी अच्छा रहा, और इससे हम लोगों को भी काफी नॉलेज है, क्योंकि यहाँ पे मैक्सिमम जितने भी केबियंस बैठे हुए हैं पीडियाट्रिशियन, वो स्वरप्राशन कर ही रहे हैं, और इससे अच्छा नॉलेज भी करंट रिसर्च के बारे में पता चला उन्हें। और मैं
रेज्ड हैंड्स, आई थिंक सुनीति कुमारी जी एंड डॉक्टर विपुल कुमार जी, would they like to ask something? Okay, one hand has been turned down. Please ask queries. Okay.
यदि किसी पार्टिसिपेंट का कोई क्वेरी हो स्वरप्राशन और करंट रिसर्च के संदर्भ में, तो वो कर सकता है।
नहीं है? Her name, I think, Dr. Payal Thakur, madam. And I'm glad that she's my first scholar in PG. So thank you. You also contributed in this language.
तो मुझे लगता है किसी का कोई क्वेरी नहीं है, क्योंकि आप स्वरप्राशन के बारे में नॉर्मली जितना है वो है, और आपने इतना करंट रिसर्च के बारे में बता दिया। तो इसी क्रम को आगे बढ़ते मैं डॉक्टर दिनेश राय सर को आमंत्रित करता हूँ वोट ऑफ थैंक्स के लिए। डॉक्टर दिनेश राय सर।
हाँ सर, थैंक यू डॉक्टर प्रशांत गुप्ता जी, योर प्रेजेंटेशन इज नाइस, थैंक यू। मैं स्वर्णप्राशन मेरी यूनिवर्सिटी में 2016 से प्रोफेसर व्यास जी के कार्यकाल से चल रहा है, और इस समय
सर इज आल्सो वेरी बिग नेम इन स्वर्णप्राशन,
और इस समय 12 केंद्र जो है पूरे जोधपुर में बनाए गए हैं। जैसे कल हम स्वर्णप्राशन कराएंगे तो 1800 बच्चों को पर मंथ में कराते हैं, और डाबर के सौजन्य से कराया जा रहा है। डॉक्टर साहब ने जैसा बताया प्रोटोकॉल के संबंध में, जब मन्नू सर वीसी थे तो उन्होंने 2021 में जहां जहां स्वर्णप्राशन कराया जाता है, जैसे पहले जो है नांदेड़ और हसन में स्टार्ट किया गया था, तो नांदेड़ से प्रोफेसर काले जी और हसन से मैडम को बुलाया गया। इसके बाद अय्या में राजगोपाल जी को, इसके बाद नैये से निशा ओझा जी को, उत्तराखंड से प्रोफेसर जीपी गर्ग को, और हम 3 लोग डॉक्टर पीपी व्यास, डॉक्टर हरीश सिंगल जी, मैं डॉक्टर दिनेश राय। तो इन लोगों ने प्रोटोकॉल बनाया था, और उसमें चूंकि सर का काफी एक्सपीरियंस रहा, मनु सर का, तो वही एक प्रोटोकॉल किया गया अब तक जो निकला। इसके अलावा हमारे यूनिवर्सिटी में 3 पीजी स्कॉलर का रिसर्च कराया गया। फर्स्ट था इफेक्ट ऑफ द स्वर्णप्राशन इन वेरियस डिजीज इन चिल्ड्रन, सेकंड था कंपैरेटिव स्टडी ऑफ द स्वर्णप्राशन एंड ब्राह्मी घृत, और थर्ड था कंपैरेटिव स्टडी ऑफ द स्वर्णप्राशन एंड पंचगव्य घृत। चूंकि हमारी स्टडी ये रही है कि स्वर्णप्राशन, सीपी, ऑटिज्म और एडीएचडी वो तो हर साल किसी न किसी बच्चे को देना ही है रिसर्च के लिए। तो आपके चूंकि जो हमारा ये प्रोग्राम हुआ था कौमार कुंभ में, उसमें एक लखनऊ से डॉक्टर तिवारी जी आए थे, और वो स्वर्णप्राशन हाँ हर डिजीज में, मतलब प्रेगनेंसी में भी दे रहे थे, सब में उन्होंने अच्छा प्रेजेंटेशन दिया था। तो स्वर्णप्राशन इस समय चलाया जा रहा है, और हमारा जो है एज ए वैक्सीनेशन के रूप में चलाया जा रहा है। तो मैं इस सभा में, संभाषा में उपस्थित करीब 71 लोगों ने भाग लिया। हम
एक दो नाम मैं भी लेता हूँ सर। डॉक्टर अमित सर हैं, अमित
हाँ,
कटारिया सर हैं, नमस्ते सर।
मैं
प्रोफेसर के उपाध्याय साहब हैं, नमस्कार। डॉक्टर डीडी सिंह जी हैं,
हाँ, शालिनी तिवारी जी भी हैं, अमित कटारिया जी हैं। मैं डॉक्टर यमन गुप्ता सर को, डॉक्टर रमेश गुप्ता सर को, डॉक्टर पंकज कुमार सिंह, डॉक्टर अमित कटारिया जी, डॉक्टर के उपाध्याय जी, डॉक्टर शालिनी तिवारी जी, और डॉक्टर पायल ठाकुर जी, डॉक्टर राठी मैडम, इसके अलावा हमारे स्टूडेंट रहे हैं डॉक्टर हिमांशु चौहान, डॉक्टर अशोक यादव और बहुत से लोग, 71 लोगों ने इसमें पार्टिसिपेट किया। मैं उनको धन्यवाद देता हूं। ये प्रोग्राम जो है अच्छा है, क्योंकि विश्व आयुर्वेद परिषद की तरफ से हर सब्जेक्ट में कोई न कोई सेमिनार होता रहता है। मैं देखता हूं जो मेरे विश्व आयुर्वेद परिषद के इस समय के अध्यक्ष हैं डॉक्टर राकेश शर्मा जी, वो एनाटॉमी में पर मंथ किसी न किसी टीचर से ज्ञान का आदान प्रदान करते रहते हैं। तो हमारी भी यही इच्छा थी कि हम मिले, कौमारभित्त के जितने भी विशेषज्ञ हैं और हम ज्ञान का आदान प्रदान करें। और ये तो प्रेम मिलन है, तो हर जगह कहीं न कहीं भेंट होती है। तो मैं पुनः सभी लोगों का हार्दिक धन्यवाद देता हूं। और क्योंकि डॉक्टर प्रशांत गुप्ता जी हमारे अच्छे वक्ता हैं, विद्वान हैं, उन्होंने अच्छा प्रेजेंटेशन दिया, उनके लिए तहे दिल से पुनः हार्दिक।
विद्वान आप हैं सर। बाकी
अरे सर थैंक यू सर, थैंक यू।
प्रशांत सर,
हाँ जी
एक
सर।
क्वेरी आई हुई है कि वी कैन कैलकुलेट द डोज ऑफ सोल्भस्म अमाउंट बाय अप्लाइंग यंग फॉर्मूला एंड फ्राइड फॉर्मूला।
देखो सर, मैं आपको सच बताता हूँ ऑफ द रिकॉर्ड, ये यंग ने और यंग फार्मूला एंड फ्रेंड्स ने, ये जिन्होंने फार्मूले बनाए ना सर, उन्होंने भी उतने नहीं यूज किए होंगे जितने ये आयुर्वेद वालों ने यूज कर रहे हैं। So that's what my suggestion is. If you are thinking that should we use that Swarnaprashan dose on the basis of young and friend, yes, you can use it. But my humble request to the research and clinical fraternity that please come out with a new dose which is more optimum for disease, for healthy, for newborn, for preterm. We must have to do it. Otherwise, one day someone else would do and then we will say that yes, ये तो हम करते थे सब. मतलब अगर let's say if we are calculating it by that young or friend, it's better to calculate it by that protocol given by the Sarvapalli Radhakrishnan University. They have calculated on the basis of some formulas and something,
Yeah,
but it is peer packed, it is peer weighted also. So by going that way, it would be more helping than going just by rational with weight and height and age. It's better going by that protocol.
सर वन क्वेश्चन और मान हुआ होगा कि ये सॉल्ट बिंदु ड्रॉप में कैलकुलेट कैसे करें हम, जैसे हम ड्रॉप फॉर्म दे रहे हैं तो सर उसमें क्योंकि कह रहे हैं कि वो नीचे सेगमेंट हो जाता है, तो वो कैसे कैलकुलेट किया जाए?
There is an issue that when you are using a bhasma, it will settle down. For sure it will settle down. And when you are, even if you are saying that please shake the bottle before using, even then the disparity would be there in each dose or in each drop. So if we are using a bhasma, it is better either shake well before use, and if it is possible then use the pattern which actually now been recommended. एक छोटी सी 1 mg की 2 mg की जितनी डोज उस बच्चे की बनती है उतने की भस्मा की अलग से लीजिए, एक चम्मच में जितना आपको हनी लेना है, घृत लेना है वो लीजिए और उसे डिसॉल्व कीजिए, दे दीजिए. This is the best way of calculating or giving a precise gold bhasma or gold concentration. Otherwise the settling down concept of metal or mineral, वो तो फिजिक्स है साहब. एक चीज जो अभी मेरे को रिसेंटली मिली that I would like to share, that a startup in Bangalore, they took a patent from US and they transformed that bhasmas into the liquid. They are giving this AG bhasma, the Rajat bhasma in liquid form, and they are saying that 5 ml of this syrup has this bhasma, pure bhasma, no other herb. That way we can transform that bhasma if into the liquid आई डोंट नो व्हाट आर द प्रॉपर्टीज, क्या रह जाएगा क्या बन जाएगा, बट अगर आपको इक्वल डोज देनी है तब आपको उसको कभी ना कभी लिक्विडेट करना होगा, अदरवाइज वो शेक वेल बिफोर यूज, बस वही सबसे बढ़िया तरीका है जो आज भी हम सस्पेंशन में यूज करते हैं। आप कभी जीफी का सस्पेंशन देते हैं, आप किसी का कोई भस्मा का देते हैं, सॉरी किसी एंटीबायोटिक का देते हैं जिसमें सस्पेंशन होता है, उसमें लिखते हैं हम अच्छे से मिला लो भैया। आई थिंक गुप्ता सर इफ यू वांट टू से समथिंग।
मैं डॉक्टर पायल ठाकुर को आमंत्रित करना चाहूंगा शांति मंत्र के साथ संभाषा का समापन किया जाए। डॉक्टर पायल।
हाँ जी सर, बोलिए।
तो सर मैम शांति मंत्र के साथ समापन किया है संभाषा का। अब क्वेरी कोई ठीक है नहीं, धन्यवाद ज्ञापन सर ने कर दिया है।
हाँ जी सर।
जी
मैं कर देता हूँ सर, कोई बात।
ठीक है सर,
थैंक यू सर।
धन्यवाद
तो
सर।
अभी ओंकार मुद्रा में आ जाएंगे और अब मेरे पीछे भी दोहरा सकते हैं। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। धन्यवाद।
आप सभी पार्टिसिपेंट को धन्यवाद। धन्यवाद।
नमस्कार, नमस्कार प्रशांत जी, नमस्कार।
नमस्ते नमस्ते सभी को सादर।
आप सबको
नमस्कार।
नमस्कार जी।